Hey everyone, welcome back to the channel. My name's Lai and I'm 27 years old, living in the UK, and I'm currently 7 months post-kidney transplant. In today's video, I am doing my first kind of hair checkup or vlog about my hair, and I'll let you know why after the intro. Hey everyone, so I want to do a kind of a bit of a series or just like check-ins about my hair. One of the side effects of Adoport or Tacrolimus is hair loss. And you may be looking at my hair at the moment and being like, hair loss? What are you talking about, Lai? Your hair looks perfectly long and beautiful as it always is. And yeah, I agree. My hair is really long and I'm absolutely loving it. I wasn't able to really have this length of hair on dialysis, really, mainly because of maintenance and just absolute annoyance of always having to tie up my hair every time I have to do dialysis because, you know, like flyaway hairs is like a hygiene risk basically, and then you would have to start all over again, and no one wants that. So I have been absolutely loving post-transplant hair in the sense like I was able to grow it really long and keep it long, and it's kind of a whole new kind of vibe and aesthetic that I've been really enjoying and loving. About the 5, 4, maybe even 3 month mark post-transplant, I was noticing that I was shedding a lot of hair. And to be fair, at the time, probably at 3 months, I thought I was shedding a lot of hair just because my hair's really long. It's probably a bit of trauma from the surgery and all that, so I kind of thought it was that. But then around the 4, 5, definitely 6 month mark, I was starting to see that I was losing kind of really thick strands of hair, and I am actually not joking when I'm saying like thick pieces like that, like whole, like from the root as well. You could see the root of hair was coming out, and you know, I wear glasses, and I also don't wear glasses in the shower. But when you can see like how thick that is without your glasses, that's when you know you're losing a lot of hair. And I would say I was losing about that kind of thickness amount of strands every time I showered, if not 2 of those every time I showered. And it was just, I was in denial for a long time, but then once I started doing some research, apparently it's really common. It's really common to start losing your hair kind of around that 6 month mark as a result of the Adoport. And it has been quite distressing, you know. I try to stay really positive, and to be fair, I am still quite positive about it. I really love my length. I feel like, yes, I've definitely lost volume at the top of my hair, but I do have hair. How wonderful. I love it. I have hair. My hair's still a beautiful colour. It's still got great texture, I think. It's just I have a little bit to a lot less of it. And I'm worried, I guess, how much more I will be losing. I feel like this amount of thickness, I'm happy with. I'm happy with this. It's thin. I mean, I don't have the volume on top anymore. If you look back at my old videos, you would be able to see that I used to have a lot of, I used to definitely try and get a nice wave out of the front part of my hair. Sorry, why did I look down? Because I literally just pulled out a couple of strands of hair, which is like, what am I trying to say? I'm actually quite happy. I'm saying I'm happy that I still have this hair. This level of thickness I can work with, you know. I can use what I have to hide the receding hairline and stuff. But I definitely want to start, you know, kind of video checkups, hopefully, of how my hair is doing, and maybe give some updates about that sort of thing in that journey. I will say that my hair is quite greasy today. Like, today is my shower day, and you might be thinking like, oh, why are you filming on your shower day? Well, it's mainly because I feel like when my hair is more greasy, I can touch it a bit more, and I feel like I'm going to touch my hair quite a lot in this video. Just because I guess they like stick together or something. Right after showering and a couple of days after, like the day after showering, my hair is like super fragile, and I find it just kind of floats away sort of thing. Like you touch your hair and like poof, that's like 5, 6 strands on the floor sort of thing. I will say, I do have a lot of hair still. I just try to do a check-in every now and then to see if it is actually slowing down or speeding up in terms of my hair loss. So as you can see, I have a much wider, to me, obviously maybe you can't tell, but I have a much wider hairlines now. So the way that my hair seems to be falling out is in conjunction with the sectioning of my hair, as opposed to like random bald spots sort of thing. So yeah, so if I lift back this, you can see quite a lot of hair is kind of come out. So it might look quite normal, right? Because you'll just say like, that's a section, you know. I tell you now, my section did not used to be that wide, and I think personally I've lost a lot of hair just like in these sections sort of thing, which is why I've lost all the volume, because they're kind of where I would normally see it. I think the back of my hair is doing quite well. I can kind of tell that it's doing quite well, but yeah, I feel like I'm losing a little bit here and there. But like I said, I'm quite happy with what I have still, honestly. I can kind of manipulate my hair to look quite voluminous and stuff. And to be fair, I think I noticed almost quite early on that I was losing hair because it was coming out in such big strands. And yeah, so I just feel like it's pretty good right now. Like, don't get me wrong, I feel like I have really good hair still, and hopefully to continue. But I've let my nephrologist know, and she says that this is completely normal. It might come back. might grow back, sort of thing. And she recommended me to take like biotin supplements, and like apparently a lot of other patients have had great success with those. So that's something that I will personally try and do. I'm used to taking pills every day. There's just adding another couple of pills is not going to make a big difference to my lifestyle. But yeah, I don't know. I just really wanted to film a video like documenting my current hair, basically, because sometimes I think, I mean, we can all do this. We get in our head when something like this happens, and we can think like we're losing loads and loads and loads of hair. I am losing a lot of hair. I can tell. I can see it on the floor. I can see it in the shower. I'm literally putting out a lot of hair. And of course my hair is long, so it kind of like double backs on itself, and so it looks much denser on the floor and in the shower than it really is, and on my hairbrush. But I can tell. And I think some of my family and close friends who see me in person can tell, in the sense like my silhouette, in terms of like my hair silhouette, has changed slightly. It is flatter, basically. It's just flatter. And I mean, that's not too bad, to be honest. I'm experimenting with different hairstyles. I'm into plaiting my hair now because I hear it's a bit more protective, and kind of sporting a more wavy look. I think all the waves have gone out almost. Yeah, I was in a plait and then I undid it, and then yeah. So, you know, I'm just trying to adapt to the situation. I go out wearing hats mostly. Hats look really great on me personally, I think. So yeah, I'm just adapting to the situation. I'm feeling quite positive. I've got a plan, which is to take those biotin medicine supplement things, and yeah, just like hoping for the best. But yeah, I just kind of, this is such a random video, I'm so sorry, but like I just really wanted to kind of document it, because, you know, I'm only ever going to be this age once. Tomorrow I'll be a day older, and the next day I'll be a day older, and maybe I'll have lost more and more hair. And I think it's really great to just celebrate the hair that I do have, and kind of just be grateful for what I have right now. And yeah, whether it gets better or worse, I'll hopefully do a couple more videos just like updating you, and maybe like my routine and stuff. Like, honestly, I want to be able to document the life that I have and that I can live, and you know, it's great that I can share with other people, and hopefully like maybe you've gleaned some insight into perhaps like, you know, you can have hair loss post-transplant, and also like your reaction to it doesn't have to be too over-exaggerated. Mind you, I did cry a little bit, kind of after really starting to notice it. I did cry, but I'm trying to be upbeat about it now. And yeah, maybe this is just another thing that I'll kind of keep you all updated with, either here or on my blog. So yeah, thank you for tuning in today, and I'm hoping you all are having a wonderful bank holiday or weekend, and I will see you all soon.